Training on bloodborne pathogens is a regulation. We must train our volunteers on safety procedures on an annual basis, so you will become quite familiar with the topic. However, knowing about this topic isn't enough. Make sure that you put to practice the information presented to you. Then, and only then, will it actually be effective. OSHA is the branch of the federal government that oversees workplace safety. They make regulations in all lines of work to ensure the safety of employees and consumers. We see this in the food industry, factories, construction, and yes, healthcare. 29 CFR 1910 are the regulations from OSHA governing workplace safety. Some of the examples of regulations that increase workplace safety include PPE, or personal protective equipment. These include things like gloves, gowns, retractable needles, and more. So we have a list here of potentially infectious material. Some of these include blood, saliva, vomit, urine, bodily fluids, skin tissue, cell cultures, chewing tobacco juice, semen or vaginal secretions. All of these are potentially infectious. We need to have a barrier to prevent any entry point of these materials into our bodies. Pathogens. If a disease is caused by a microorganism, it is generally referred to as a pathogen. These include parasites, bacteria, fungi, and viruses. In this training, we talk about 3 major bloodborne pathogens: hepatitis B, hepatitis C, and HIV. Hepatitis means inflammation of the liver. It's most often caused by a virus. It's important to note that many people who live chronically infected with viral hepatitis may not even know they are infected. They can live symptom-free for years. That is why practicing standard precautions is so important. People simply may not know that they are infected to even let healthcare professionals know. Symptoms for hepatitis include jaundice, the yellowing of the skin, a sign that the liver isn't functioning well, nausea, fatigue, and abdominal pain. Hepatitis B is more infectious than HIV and can survive outside the body for up to 7 days. There is, however, a vaccine for hepatitis B. It is a series of 3 shots. There's the first one, then one at 3 months, and another at 6 months. There shouldn't be any need to redo the vaccine once you've had it. There is a test to verify if the vaccine was effective. This vaccine is free to any Center for Hospice Care volunteer whose job puts you at risk. These would be any volunteer opportunities that would have any patient care tasks, such as a home visitor or inpatient care unit volunteer. The symptoms for hepatitis C are the same. However, it is believed to be transmitted only through blood. It may be a bit more difficult to contract. However, there's no vaccine for hepatitis C. There are some more recent treatments for hepatitis C if caught early enough. HIV attacks the immune system. It is the virus that leads to AIDS, but HIV is not the same as AIDS. The symptoms of AIDS vary widely from person to person. HIV doesn't survive well outside the body, therefore, there is no threat to contract it through casual contact. There is no vaccine to prevent HIV at this time. Needle sticks cause 80% of exposures to hepatitis B, C, and HIV in healthcare workers. These occur most often when healthcare workers are disposing of needles, giving medications, drawing blood, or handling trash and dirty linens. As volunteers, you will never be handling sharps or sharps containers, either in the inpatient care unit or a home setting. However, as a volunteer, you may handle dirty linens or trash, which is why it is vital to wear gloves during those tasks. Hepatitis B, C, and HIV spread most easily through contact with blood. Contact with blood can happen when you puncture your skin with a contaminated sharp. Again, volunteers are never to be handling any sharps. Blood can also enter the body through splashing onto your mucous membranes, your eyes, your nose, your mouth, or non-intact skin, such as open wounds. This is why we teach you how to make sure you have the proper PPE to protect yourself when doing patient care skills. Standard precautions is the term we use to define treating all fluids as if they are infected. Patients themselves don't know if they are infected. Therefore, we have to treat all fluids as if they could potentially infect us. It's more than wearing gloves. It's how we disinfect rooms. It's proper hand hygiene. It's how we wash linens. It's being cautious in many areas. PPE, or personal protective equipment, is a very vital part of standard precautions. Volunteers will be provided with a supply of gloves so they can wear them when performing personal care tasks, taking out trash, or handling dirty linens. Gloves, eye gear, and masks may be provided in the inpatient care units, and rarely, but sometimes in the homes, for situations where blood may splatter. Center for Hospice Care staff will instruct volunteers on the need to utilize these other forms of PPE. As we've said multiple times, use gloves when handling trash or dirty linens. PPE are only as effective as they are good, so keep these steps in mind when putting on gloves. First, inspect the gloves to make sure there aren't any tears or defects. If there are, then get a new glove. Go about your work, and then when done with the task, remove the gloves in the proper way. The YouTube video on removing gloves will show you how to do this in the most effective way. Remove and dispose of gloves before leaving the contaminated area.
Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to show you how to properly remove soiled gloves. So our goal is to remove our gloves without getting the stuff that's on our gloves on our skin or on our scrubs. So what we're going to do is we're going to take our thumb and our index finger and we're going to pinch the cuff of one of the gloves. Then we're going to take the glove and peel it off, and we're going to grasp the glove completely in our hand and close our hand tight. Prevent it from hanging down because we don't want to touch it. Then we're going to take our index finger of our ungloved hand and we're going to slide it underneath the cuff of the glove. And we're just going to peel it off, and it puts it in a nice little bunch, and then we're going to throw it away and wash our hands. Thank you so much for watching, and don't forget to subscribe to our channel for more videos.
Hand hygiene is the simplest and probably one of the most effective ways of preventing the spread of pathogens. If your hands aren't visibly soiled, it is permissible to use a waterless, alcohol-based antiseptic. Center for Hospice Care will provide volunteers with the approved hand sanitizer. Washing with soap and water is always your most effective method of hand washing. If your hands are visibly soiled, you must wash with soap and water. It's important to remember that the vigorous scrubbing is quite important. Make sure to focus on cleansing all fingers, including the thumb. Cleanse under the fingernails, go up on the wrists, between the fingers, and make sure to do this for at least 20 seconds. You can sing the alphabet song or happy birthday a couple times to make sure you wash for the right amount of time. Let the water drip off your fingers into the sink. Dry the hands, and it's best to turn off the faucet with a paper towel. It's important to make sure you're not performing certain tasks around bodily fluids, such as applying lipstick, handling contacts, or eating or drinking. Also remember that the greatest risk of exposure is when handling contaminated sharps. As I've said before, all CHC volunteers should never handle any sharps while volunteering with us. However, it is good to know these safety practices. Never recap used needles, don't bend or break needles, and never ever reuse sharps. When done with sharps, make sure to dispose of them in an appropriate sharps container. When transporting sharps, close the lid or lock it when the container is full. When sharps containers are full, they are then disposed of in our biohazard boxes, where they will be sent off for proper disposal. If you are exposed, don't panic. Respond quickly, but most exposures don't lead to infection. Wash the area thoroughly with soap and water. Flush eyes and other mucous membranes with plenty of clean water. Then you must notify your supervisor. You will need to notify your supervisor immediately. They will walk you through the next steps. HR and/or your supervisor will help you with the procedures to take after an exposure. You will need to go to the health clinic for an evaluation. Make sure to take the appropriate paperwork with you. The doctor will evaluate and order any needed follow-up. An incident report will need to be filed, and follow-up with a QA coordinator will be scheduled. Know that following these safety precautions has been proven to be effective. Since the 2001 regulations took effect, we've seen at least a 51% reduction in work-related needle sticks. This percentage may very well be more than that at this point. Learning about bloodborne pathogens is something to take seriously. We train on this annually. 1, because we have to, but 2, because it is so important to learn the skills to keep us safe. Make sure you don't just make this head knowledge, but make it a habit. It's for your safety and our patients. For more information, feel free to check out these references.